All right. Thank you all for joining us tonight. It is my privilege to welcome Patty Kunze to present to us on promoting your own health, empowering people with disabilities to take control of their own health. I'm Caitlin Berry. I'm the Health and Wellness Outcomes Manager at Sportable. And I run a lot of different wellness programs, including these wellness webinars that we try to host monthly with a variety of experts in different fields presenting on helpful topics. A few housekeeping things before we get started. This presentation is being recorded. You're welcome to have your camera on or off. Typically, it only records the person who is speaking, so it's unlikely you'll be featured in the recording, but we will post it later on YouTube if you want to access any of the information or take some additional notes. It will be available online that way. And with that, oh, one more thing, throughout the presentation, go ahead and mute your microphone unless you're Patty, so we don't get any background noise. If you have any questions, Patty has said you can raise your hand or raise your little Zoom icon hand and ask your question during the presentation. You're also welcome to throw kind of lingering questions into the chat, and we'll leave some times for question and answer at the end. So with that, I'm going to go ahead and introduce Patty. So Patty Kunze has been a registered nurse for over 30 years, and she wants to share her knowledge when it comes to taking charge of one's own health. Graduating with a Bachelor of Science in Nursing, she has worked in the Spinal Cord Injury Unit, Neonatal ICU Transport Team, Labor and Delivery / Newborn Nursery Management, and was a nursing instructor for nursing students. In 2009, she was in an auto accident, leaving her a T4 complete paraplegic. In 2012, she created the Rolling RNs, in which she writes medical articles to help others with spinal cord injuries understand their own medical issues in an easy to understand method. She is not only a nurse, but a nurse who lives her life in a wheelchair. And we are so proud to welcome her here tonight. So I am going to go ahead and share the screen of the presentation. And then I'm going to mute myself, and Patty, you can take it away.
Thank you, Caitlin. I want to thank everybody for being here with me today. I want to thank Sportable for asking me to present this topic, and I hope this will empower you all to regain total control of your own health. Like Caitlin had just said, I've been a nurse for, actually, it's going on, it'll be 40 years next year. I can't believe it. But I was in spinal cord injury unit as a nurse my first 2 years at a VA hospital. So I knew a tiny little bit about spinal cord injury, which actually probably made it a little bit more difficult for me knowing what I did know. Caitlin had just gone through my entire background, but once I had my car accident, the career that I had worked for many years suddenly came to a screeching halt, and I wasn't ready to hang up my nursing cap yet. So I did create the Rolling RN because I'm finding that there were many people that had lots of questions about their medical care, but they were unable to really get the answers to it. So with different things, I try to break them down. I've really kind of written the articles somewhat of an elementary level for people to fully understand, because nothing is worse than going through and not understanding anything that the article is about. So then after I had created this, like 5 years into doing the articles, I met another paraplegic nurse who actually lives in Texas. We've never met each other physically yet, but we are the best of friends. We work together. We both think alike. So the Rolling RNs were created. So, and most of this story is really, it's about me being a registered nurse and the information that I've learned. But this is coming from the fact that I was a wife to a husband that had malignant melanoma, and he had it for 11 years. And I've learned more from being the nurse on the outside now looking in and trying to maneuver the medical system. So also, I just want to let you all know that on the Rolling RNs, I've got maybe about 70 articles that are in there. They're on Facebook, and we also have our website. So now let's get into this topic. I just want you all to know I am not going to be talking badly about any doctors. So whatever I do say, it's coming from the experiences that we've had. Doctors are great, but we have to keep in mind that the doctors have had this additional education. They know what they know with their area of expertise, but they don't always know, just like us nurses, we don't know other areas of medicine. So anyway, that is what I'm getting into. So how did this public service announcement come to be? I had written an article about take control of your health. And then Caitlin had read the article. So she came to me and asked me, would I present this in a webinar to you all? So I went back, pulled information out from the article, and here I am presenting this. So this article that I had written actually came from a high school friend of my husband's. He had called my husband and said that he had cancer. I don't remember what type of cancer he has, but he had cancer. And so he said that, he didn't really know what was going on in his life, but that the doctor had things under control. So my husband said to him, look, my wife is a nurse. She's helped me through all of these things. She'd be happy to help you. Any questions you have, let her know. And his response was, it's okay. My doctor has it under control. I don't really know what's going on, but I trust him that he'll take care of things. I'm like, oh. And I was like, oh. So I wrote this public service announcement as to how to take control of your life and your health. Thank you, Caitlin. So all of you all, my friends, roll onto my soapbox with me, because this is really, it's me on my soapbox, and this is a topic that I really enjoy. I want you all to be comfortable, ask questions as we delve into this topic of maintaining control of your own healthcare. So then, to understand this, we want to understand the need for empowering our own healthcare. How do we ask the pertinent questions and not be shy? And then why? Just why do we want to maintain our own health and not just rely on what the doctors are saying to us, or healthcare personnel? So raise of hands of how many of your friends go to Facebook and ventilate about a recent doctor's appointment and ask for medical opinions. And yeah. See, there you go. That and being in the spinal cord injury Facebook group, I see it all the time. And in fact, I was answering questions that people would ask. I would share my articles. And one of my friends on there that I had not met, but he knew that I was a registered nurse, he told me, he said, Patty, you need to start answering these, and you need to say that you are a spinal cord injury nurse yourself, that you live it. So I did start answering them that way. But you see, when people do these kind of things, they go to their doctor, they come home, they start thinking about it. So you see the wheels start turning in their brains, and they start asking these questions. But what happens when these questions come about and people start sharing their own information? It gets totally convoluted for the poor person that's asked the question. So the whole thing with this is ask your physician first, not go on Facebook. I mean, if you want to do that, that's fine, but just to know it's going to get confusing. And usually when you find these people ask these questions, they don't give you the whole story. Just like today, just came in, had a person that was on Facebook group saying that he had severe pain in his left arm. Severe pain, he said, now I'm on dialysis, and I don't know if that's causing it or not. But so I said to him, I said, is it in your graft area? Is it, you have dialysis on your arm? He said it was his left arm. He said he had to graft in his left arm. And then he says, well, no, it's not that. I don't get that type of dialysis. So the best person to ask is a doctor, because your doctor has the medical records in front of his face. They also have, you can go through and ask your doctor through the MyChart. Everybody has the MyChart and send the question through. If it's not an emergency question, if it's an emergent question, I would call the doctor. But if it's not, I just go through the MyChart, put the question through, because the best person to clear up all these parts to the puzzle is going to be your physician, not your friends on Facebook. So select a family member or close friend to be your medical advocate and understand your body, understand the medical terminology. And if you don't understand it, ask for further explanation. Write it down. If you're confused about something the doctor said, write it down. You can research it. If you're still confused, call your doctor back up and ask them before you agree to anything treatment-wise. I know when I was hospitalized, I pretty much told my husband constantly. He hears from me as a nurse as to what to do. So when I had my car accident, I was in a coma for about a week or so. And I know and today I still look at that. He had brought to the hospital a notebook, and he wrote down every single thing the doctor was saying. So as time progressed, he could always refer back to those medical information that he had in there. And he could refer back to that and talk intelligently. My husband was a hospital administrator, but he did not have the medical background that I had. So we worked well together, but like I said, he didn't have the medical information, but he kept up with it all and did a great job with all of that. So have someone that understands what's going on with and what you want to do with your life. This was a great quote that came out of the article that I had written, and I've got to move everybody over out the way because can't see it all. Everything is within your power, and your power is within you. This was a great quote that I found by Janice Trakeman, that catching what life throws at you, inspiring true stories of healing. And we're going to talk more about stories of healing a little bit later on. But I thought, this is your body. This is what you need to have the power within yourself and maintain that power. My favorite question, let me give you a little background to this. Your doctor will be coming in, depending on what's going on, what you're there for. Let's say you're in the hospital. The doctor's going to come in and he's going to outline several treatment options about your injury, your illness, whatever the condition may be. And way I came up with this, my favorite question was, my doctor was seeing his oncologist for his cancer. And she came back to him and she said, we could do chemotherapy, we can do radiation, we've got these other treatment options, we've got this, we've got that. And my husband and I are looking at each other. He's looking at me to try to get some guidance. I never worked in oncology. I don't know anything about oncology. So I came up with this, and it was just like, so my favorite question at the time, it was a female doctor, and I knew that her mother had also been an oncology patient. And I looked at her and I said to her, what would you do? What would you choose if my husband were your brother, your uncle, your father? What option would you, doctor, choose for my husband? And then it was funny because I'm sitting right beside her and I'm looking, and suddenly you see the wheels going backwards in her brain thinking. And she told me, she said, this is the option I would choose. Like, fine, great. That's a great option. Let's go with it. So then after you ask that question, they give you the answer and say, great, that's a great selection. Why did you choose that option? And how can we now implement that treatment? And I do that, I do that whole same thing, even when I'm in the meat counter and I have the meat man stand behind the counter and he will ask, what steak do you want? You're the professional. You tell me which is the best steak. And it's funny because you see them now, they lift up the top layer of the steaks and go down below and pick out a good one below. So I use that question for lots of different things. The interrogative boldness, that is something that also came out of my article, that you need to have an interrogative way about you. And sometimes you have to reach down very deep to find that boldness. Now, the boldness cannot be confused with being a bully. You don't want to be a bully. There's a fine line between bold and being a bully. Don't be afraid to ask clarifying questions. Doctors can be sometimes the worst educators. Recently, I had a procedure done on my body. It was just a few weeks ago. And it was something that I had done about a year ago. It didn't work. I went back in this past August to have it redone. So I had lots of questions that I was asking the doctor, and I really wasn't getting straight. I really wasn't getting answers that really answered my questions. So while I was being prepped, I asked the nurse, I said, look, I said, I have this question. I asked Dr. So-and-so, and this is what he said. And she said to me, and I was really wasn't surprised, but she said, you know, Dr. Smith, he's not the best on education. And she's right, he wasn't. And I also found out, and this is a nurse trade secret, that doctors want to be the ones to look good. They don't want to give bad news. They don't want to do any of that. They always want to give good news. Just like Caitlin has said, I'd worked neonatal intensive care, and I had. And those are the little bitty babies that, depending on when they are born, as to whether or not they do well or not. And so many of the doctors would say, your baby's going to be fine. When you know deep down, that baby is probably going to have a little bit of difficulty, but they but they don't share that bit of information. So just get that interrogative boldness going and continue to ask questions until you are satisfied. Treatment plans, and what are they? I think there's another piece there, Caitlin. A treatment plan is a collaborative plan that everyone, physician, nurses, physical therapists, dietitians, lab personnel, they're all aware of the treatment plan and they adhere to it. A treatment plan example for you all, I know most of us are in wheelchairs, and let's say you have that dreaded urinary tract infection, or you think you do. So let's say you go to the emergency department, you started with these symptoms late on a Friday night, Saturday, Sunday, when your doctor's offices are not open. So you go to the emergency department, you've got symptoms of a lower back pain, you've got some dark urine, you've got some fever, you feel a little nauseated, not able to really keep any food down. And the initial treatment plan at that point in time would be the nurse is going to ask you your history, your medical history. She's going to obtain some vital signs. She's going to ask for a urine sample. That is a treatment plan from the beginning. Everybody knows that's the routine. That's how things go. But then let's say that your urine results come back from the lab and everything is normal. There's no signs of a UTI from that lab result that you had done. So now suddenly that treatment plan's got to take a different direction. The doctor will come in, look at all this, and now he may send you for an ultrasound, may see what's going on, why you're having this lower back pain, why you're having this nausea. So your treatment plan is going to suddenly take a different direction. As for it, when it comes to treatment plans, I do have another story, like I said, from my husband. When he was going through the options that we had talked to the doctor about, and we had chosen a series of 4, it was an IV series that he would get, a series of 4 treatments, and they would be given like once a month for 4 treatments. He had just received his second treatment and he came home. He looked horrible. Now, I'm not the one to drive, and he wasn't able to drive. So a neighbor had taken him to the doctor's office for this treatment to be done. He came back home. He looked absolutely horrible, wiped out. Okay, well, I contributed to that. Now, I just want you all to know about my husband. He had this for 11 years, but really 10 years, 9 months, he was totally, everything was great, fine. You never saw any real symptoms. Most of the things he would come back from real easily. But this one, he had just received a second treatment. He could not walk the room without holding on to the wall. And he would walk from wall to wall to wall to get to the bathroom. And it's like, something's not right. I let him sleep it off overnight. The next day, he was even worse. So I got up the next day, I called their doctor's office, and I told him, I said, look, I said, this is what's going on with my husband. This is what I'm seeing. I'm a registered nurse. This is what I see. Can he come in just for some IV fluids? Let's just give him some IV fluids. Let's see if he can get better. Let the doctor look at him, see what's going on. This was after treatment number 2. So she argues with me. So I went through it again, and I was very adamant. This is where that boldness comes in. You come back, you get this boldness about you and say, no, I want my husband to come in. I want someone to lay their eyes upon him. So they finally got tired of my boldness and said, okay, bring him in. So my neighbor took him back in and brought him back home, and he looked exactly the same as he did previously. So I said to him, I said, honey, I said, did they give you IV fluids? Yes. Did the doctor see you? No. The doctor never saw him after that. So I immediately got on the phone, called another physician's office, told them exactly what was going on, what was happening with my husband. And they immediately wanted to see him the next day, and they informed me that if he had received the 3rd treatment, he would have died. He was in bad shape at that point in time. But that's where I'm saying that boldness has to come up out of you when you just feel that something's not right. What can you do? And don't be afraid to do this. Don't be afraid to go up against the medical personnel. And like I said, there's that fine line, but be very nice about what you're doing, but be very stern about it. And the other part of that is when I go to treatment plans, when you go into your doctor's office, and I've seen this as a nurse, don't go into your doctor's office and when they say what's going on and you say, I don't know, I just don't feel good. I just want you all to know doctors are not magicians and they can't just pull something out of their hat and know what's happening. So you got to give them a little bit to go on too. I know that was a little bit long. So review your own medical records for accuracy. And you're going to see, I know my doctors do it, and I'm sure most of them do, that they all have the my charts, as we've been saying. But every time I go in for a doctor's office visit, they give me a piece of paper to explain exactly what had been done that day, reviewing my medicines that I'm on, reviewing my medical history, reviewing what the doctor had been done for me that day. So when you get those pieces of paper from your from your office visit, don't just go home, throw them away and not look at them. Review them for the accuracy. and just to make sure that everything is correct. And if it's not, then go back and let your doctor's office know, wait a minute, I'm not on this medicine anymore, or no, this is wrong, or this is right. Whatever it is, let them know.
Patty, can I jump in and just give an example here?
Please.
I had COVID last year, one of many, and it took me out, though I was vaccinated. It was very hard on my whole body. And I went to patient first. That's who diagnosed me. And when I was looking at that paperwork and I got home, not only did I have a COVID diagnosis, but I had a pre-hypertension diagnosis, which was only based on just my pulse from the pulse ox from that evaluative visit. And I am not pre-hypertensive. I'm an avid marathon runner. Like that my cardiac condition is fantastic. But I was like, why would he do that? And it was just because he saw that heart rate was like 120 at resting. He diagnosed me pre-hypertension, and that wasn't the case for me. So checking it and checking all those little papers is important. In some places like patient first, it really is almost little receipt papers, but looking at your MyChart, whatever it is, and reviewing your records is very important to make sure they're correct and that somebody's seeing the full picture of you and not just that moment that you're in the office.
Thank you, Caitlin. You're right. And ask for a second opinion if necessary. There again, like I said, I went and immediately got a second opinion on my husband because I felt, deep down in my heart, I just didn't feel it was right that he came in and was that sick and a doctor or somebody didn't, they just kept telling me that this was a normal side effect. And I just knew this was not a normal side effect. Even though I didn't know oncology, this was not. So don't feel bad if you want a second opinion, and tell the doctors, hey, I'm coming in for a second opinion. This is what my original doctor said. Don't be shy, let them know. And if you need to, ask friends for recommendations. Friends can certainly give you recommendations for a good doctor. And not all doctors mesh. You may not agree with one doctor. Somebody else may love that doctor. It's okay. It's okay. So my take-home message for this public service announcement is, if your heart and your gut are sending you mixed signals to your brain, think twice before agreeing to any treatment that is being offered to you. Take a step back and think, is this what I really want to do? What is the procedure that they are offering? What is the recovery time? And will this be followed by any rehab or whatever the situation may be? Ask questions, ask. And don't be concerned when you get the 15-minute visit that you're on. Ask until you're satisfied. Here again, one of the examples I have, let's say you're going in for upper respiratory infection, whatever, and the doctor puts you on amoxicillin, and then you go home and say, I don't know why this doctor put me on amoxicillin. Amoxicillin never works for me. That was the time there and then to say, doctor, amoxicillin doesn't really work for me. I really would prefer something else. Let them know. Don't be afraid. Don't be shy. Just take that boldness and go with it. All right, these pictures, hold up, Caitlin. Okay, that's okay. This, I put a couple pictures on here because these made me laugh. This first picture, I gotta put my glasses on to read it. This first picture just came up in one of my spinal cord injury groups. And they put the bar for exiting the door, but it says, please tap the bar gently with your foot to open. Now, I don't know about you all, ain't no way I'm going to be tapping that with my foot. My foot doesn't move. So, they were being very helpful by installing this contraption to open the door, but I'm not sure. I don't know if you can touch it. I don't know if it's supposed to be hands-free. I'm not sure what that is, but that's not going to work by tapping it with your foot. But I thought that was a little bit comical. Second one that Caitlin's going to put up is really my pet peeve. This one is my huge pet peeve, and I'm glad I could get a picture of it. Most of you, I know you're all muted, but this one, as almost every single bathroom I've ever been to in the 13 years I've been in a wheelchair, I see this. And the soap dispensers are always up higher than I can reach. Every time I go to a bathroom, I have to take a friend with me because of being a nurse, because of COVID, because of flu. I'm always adamant to wash my hands. So I always have to take a friend with me. I have to get a friend to put soap on her hand, to put soap into my hand, because I can't reach it. And the other part with this picture is look where the mirrors are. And I want to say, I find this frequently in hotels, is just put yourself in a wheelchair and roll around and see what you can see. It's very simple. And I've done a lot of education when I go to a hotel as I'm checking out. And I would tell them very kindly, you might want to consider lowering your mirrors a little bit, or you might want to do this, you might want to do that, because you can't, you just don't know what you don't know. But this one was really, it's a pet peeve to many of us in wheelchairs, is that we just can't reach the soap dispensers. And actually, there was a rehab facility that had just opened that they had sent around a video showing what they were going to have in the rooms and all, and how nice and neat this place was. And I looked, and every single one of the patient rooms, the soap dispensers were elevated, just like this. So I said to them, I said, what about your soap dispensers? And I go, oh, we didn't even notice that. So I think the soap dispenser person is not in a wheelchair. So just notice those things. Come on, people. So again, don't be afraid to challenge your primary care physician to that. See, Sierra's a friend of mine. I see that she's at the bottom down there. Don't be afraid to challenge your primary care physician. You can always say, help me understand. That's a great question that I always say to them. Don't be afraid to challenge them. Help me understand, what am I supposed to be doing here? The other part with this, I just want you all to know, I've got all of this information, all of my medical history is on my phone. Most of them have little apps that you can put on there that have all of your information. And my family, every single family member I have knows it's all on my phone. So it's there in case something happens, they can refer back to that. Also make sure your allergies are noted, because if you go into a hospital, let's say you're in a coma, they're not going to know your allergies right off. Make sure everything is listed in your phone to have that. Also, meaning do not be intimidated or shy about asking the whys and hows concerning your care plan. Understand the proposal and the path being taken to obtain that end result. That's what I'm saying, before, is make sure you understand exactly. Don't sit there, and I don't know what the percentage is, and I know there was a commercial years ago going around about how much the patient actually consumes in their brain on what the doctor has explained to them. Don't be afraid to sit back and say, okay, help me understand what we're going to do here. And taking this approach could possibly save a life. And I know that's being a bit dramatic, but I just want you all to maintain control of your own health. Like I said, my husband was diagnosed in 2007 with malignant melanoma. I had my car accident in 2009. My husband was driving, he was also with me. But between the two of us, I never allowed his cancer to paralyze his life. We kept on living. And there again, like we were just talking earlier, is my family never allowed my spinal cord injury to stop us from living. I still continued on. We did things that people would never believe because we worked together. But I believe that my husband survived 11 years of the malignant melanoma because of taking this approach and being in control of his health, me being in control of his health, him being in control of my health, is we took care of each other. And I think that's possibly why he survived 11 years. He was diagnosed, two other physicians that he knew was diagnosed with the same thing at the same time he was, and both of them only lasted about 2 years. And I'm not saying that, I just don't know. I just don't know, but I just know I got 11 years out after his diagnosis. And if you feel you're being ignored, if you feel that you put phone calls into your doctor's office, if you feel that your physician is just not listening, feel free to kindly escalate. Escalate if you feel like you're not getting the treatment that you should be getting. And there again, like I said, my husband was a hospital administrator. So these are things that I knew as a nurse, but I've learned from him too, is every medical office has an office manager. Every office manager responds, has an administrator that they report to. So somebody always has somebody above them. Most often I find that if I talk to the office manager, that person will take care of what needs to be done. She will talk to the doctor, she'll explain what's going on, and usually I don't need to escalate any further than going to the office manager. But
I'm sorry, y'all. I think Patty just froze. Hopefully her computer did not die. Bear with us for a moment. Patty, are you there? Y'all hear background noise on my end. My sprinkler is running outside this front window that I'm adjacent to. Oh, looks like Patty's computer may have died. We'll hang tight because I'm sure she will be back as soon as she can. Good to see you all. And Sierra, welcome. I know Patty mentioned you're a friend of hers. Oh, let's see. Is she back? Maybe.
Sorry.
There you are. I knew you'd be back as soon as you could.
my internet, I told you, internet here is very spotty, but I was surprised this lasted as long as it did. But I think we're beyond that one, Caitlin. All right, this is just one more thing, and this is just my nursing tidbit that I wanted to share with you all. I truly believe in medicine, that it's mind over matter. I truly believe that that's what got my husband through 11 years of his cancer. Like I said before, that I never allowed him to be paralyzed because of his diagnosis. But the one more thing that I wanted to share with you all is, and my husband knew this when I had my car accident, and I did this being a NICU nurse, I never allowed a parent to cry at their baby's bedside. I never did. I found, like I said, that the mind has an enormous healing potential. So my husband knew that by me being a neonatal intensive care nurse. He said, you never allowed anybody to cry at their bedside. So when I had my car accident, my husband didn't allow anybody to be in my room sobbing. My mom came in the room I was the oldest of three daughters. My mom came in the room to the ICU and she was sobbing. My husband escorted her out of the room and told her, get herself together, take your crying elsewhere, and when you're better, come back in. And we always laughed that my husband was a gatekeeper, but I truly believe that the mind has a way, and you will see it on TV too. You see these doctors that talk over the patient's bedside to the family member that's saying, your family member is not going to make it. He's going to die. He's not going to go. Things are not going to go well. If I hear that, I'm going to be sitting there thinking, I'm supposed to be dying, because I can tell you, and this is the one more thing, that when a person is in a coma, and I can tell you this because I know it, when a person is in a coma, they can still hear. I could still hear. I could not respond that I was awake. I could not open my eyes because I was in a drug-induced coma because my blood pressure was too low. I couldn't handle anything being done to me. But my husband and my sons both saw my heart rate would elevate every time they would come in the room. And they would sit and they would talk to me about their daily events, whatever need to be done, but they never allowed sobbing or crying, anything to go on in my room. They never allowed the doctors to come into my room and talk over my bed either. So that was the one thing. My husband was the gatekeeper. And like I said, I never allowed any of my doctors that I was working with to do this either. So that's one thing that if you don't learn anything else out of this webinar, I want you to know that mind is just, it's an enormous healing thing. So if you take a positive attitude, if you do well, don't cry over the bed. It's just, I can tell you from my own experience. So in review, do we now understand the need for our own empowerment? Can we now ask the pertinent questions in regard with a boldness? And now do we understand why take control of your own body? Now, any questions? I guess, Caitlin, you can unmute everybody. I will roll off this soapbox. This is a topic that I'm always very excited to share the information that I've learned from being the wife throughout this with a bit of nursing knowledge.
Thank you, Patty. That was so good. This is Danica. Can you hear me?
Yes, I can, Danica.
Okay.
Thank you very much.
Okay. I have a question. What are your thoughts? I have no problem with the boldness aspect.
Danica, somehow I know that.
But what are your thoughts about being your own medical advocate? Because I feel that I do that all the time, and I go to my appointments by myself and have no problem asking every question.
And you should. If nothing else, that's what I want everybody to get out of this. And like I said, I want you to be your own advocate. That is great. And it's also great, and I didn't mention that, write down questions before you go to the doctor's office. I know lots of time when I go, I may completely forget everything that I want to ask. And then I'm like, oh, I meant to ask so-and-so. So write down those questions, be your own advocate, but also, like I was saying, to make sure somebody else knows, because like I said, I'm usually my own advocate when I went to the doctor, but after my car accident, when I'm in induced coma, I couldn't be an advocate anymore. So yes, truly be your own advocate. And I think, I'm not going to say for sure all doctors, most of them prefer you to be your own advocate, to come in and ask those questions and do what you think is right for yourself.
Okay. All right. And the other thing, one of your comments, it spoke to me when you were like talking about the doctor. You were saying you ask the nurse, what would you do for your brother? Because I
Yes.
have a brother, so that like spoke to me. Like I never, they give you the options and I picked one. I never was like, oh, if I were your wife, what would you pick? I never even thought of having that in my decision process.
Good. Then use it, Danica, now.
I will.
Use it, because I use it all the time. I always, like I said, that was something I didn't know as a nurse. I didn't know that. And then I started, once I saw and you just see it, when I was watching her, I saw her whole demeanor just change. And she softened to be now the daughter trying to make a decision for her own mother.
Right.
And she just softened. Well, this is what I would do. Because I said, what would you have done if this were your mom and you gave these options? Which one would you have chosen?
Right.
And she said, you could just see it suddenly. You see the wheels turning for what, knowing the whole big picture. Because as I said, the doctors know the whole big picture, but now suddenly they're presenting you with these options. Like again, I don't know the options. And there again, like you said, Danica, you probably don't know the options for your brother, what they truly mean, what that's going to come down to. So doctor, help me understand. Help me make a decision here.
And I am one of those people that takes the medical records and I throw them in the trash can. Never crossed my mind to look at the accuracy of it. So now I will.
Danica, I'm so glad you missed your cycling class tonight.
Ah!
So you got a few things out of this. I'm so excited.
Yes,
please. Because that's going to go into your medical records. That's going to be there. And like Caitlin said, I've seen that many times working in a hospital, that, when you go into the doctor's office and you're scared to death, you've rushed in, there may be traffic, you're trying to get a parking place, you rush into the office and what do? They immediately take your vital signs and take your blood pressure. Well, guess what? My blood pressure is going to be sky high after I've gone through all of that. So, and now Caitlin would have had on her medical records that she has this hypertensive thing going on, but she doesn't really. So, if they bring that up, I would have said, wait a minute, let me relax and let you take my blood pressure again later on through this meeting. And then let's see, and then let's get that taken back off of my medical records, because now it's there. It's there now. So, and that's the same thing with me, is they've been watching me for my blood sugars. One time I misbehaved. It was right around, I don't know, holidays or Valentine's Day or something. And, the candy was just flowing and I was sneaking a little piece here and there. Well, when I went in for my lab work, my A1C was quite elevated. So now that's on my records now all the time. So my doctor looks at it every single time. So even though I completely behaved myself, got my diet straightened out, got my A1C below 6, and did great because of my diet, that's the only thing my doctor zeroes in on every single time when I go to see him is, okay, how's your blood sugars doing? They've been fine. It was a one time I messed up. And it's the same like with Caitlin. The one time that she had the high blood pressure, it's like, get this thing off of my chart. So,
okay, that's all my notes. Thank you.
Well, I just had a comment. I didn't have a question. It was about Target has those little things at the door, and I'm like, I'm walking with a cane and I'm already having a difficult time. How am I supposed to use my foot and flick that open and do all of that? It's just too much. Yeah. So I feel you on that.
No, and I agree. There's so much that still needs to be done. I know, like I said, I had to go in for my lab work this past Saturday, and I can't get in the door. I can't get in the door of the facility. So my sister always goes with me. She usually waits in the van, but she has to go and open the door for me. And then coming out, I have to ask somebody to help me with the door. Those doors are not, you can't get in or out. And if you can, they're just so heavy. I can't physically, or if I do it, I'm going to break up the door trying to get in and out. And that I don't want to do either. So yeah, it's just, that's still a work in progress for all of us that can't get around.
Hopefully the world will get with it one day.
Yes. Anything else?
Yes, I have a few.
Okay, Jerry, hit it.
Well, first of all, my questions come from a perspective of someone who basically I passed out from high blood pressure and I woke up 6 months later. And I wasn't fully cognizant of what was going on. It really took me 2 years to really get my brain functioning again. So that's where these questions are coming from. So what should we do if we don't have someone we can trust to be an advocate for us?
That's a very good question, Jerry. And that's an answer I don't really have because I just, like I said, I've got 2 sons. They know. Do they really truly know? I don't know. But there again, like I have it on my phone. My sister knows. And maybe somebody else has an idea as to what. Did anybody else have any ideas that they don't have? If they don't have an advocate, who would you trust?
I think that's the thing, is finding someone you would trust. They do have where you can make your own, you would have to go through a lawyer. And then I've seen some institutions, they do have their own paperwork where you make your decisions and you put it in writing and you sign it and they scan it into their system, like the My Health system. So then it's there. So if something was to happen and you don't have someone you trust that knows your true wishes, then they would have that. And it could be used as a legal document on your behalf.
Okay.
So I know that so a lot of lawyers give free consultations where they, like with estate planning and all that, so they can at least tell you where, how to go about doing that if you want to use a lawyer, or if there's a way you can do it and have it notarized maybe and put
What's
into
the
your
name of it?
medical
Because you were
record.
breaking up when you said it.
I'm sorry. I don't know which part I broke up with.
At the beginning, you said there's a.
There are some places like health systems that will have an event like where if you can't make the decision that yourself, and if you don't have someone that you trust, then you can go on and make the document yourself. Some lawyers will do a free consultation, like estate planning lawyers, where they can talk to you about like if you have to use their service to get a legal document saying what you want your wishes to be. Or some people will use, like some hospital systems will have something printable that you can write your request and then you can have it notarized and put in your health record. So if something was to happen and you don't have someone that's on the same page as you, then you have a legal document in your chart that says what you want done or how you want things handled.
And
Okay.
that is Dr. Sierra Funk, a friend of mine that we taught nursing school together. Thank you, Sierra, for that. She said she was going to come on here just to see how I was looking nowadays, because she's
You
now in
look
Pennsylvania.
awesome. I know.
Thank
Well,
I
I got a good question for both of you all. What do we do when it's clear that the nurse isn't agreeing with the doctor, or if you never find out, and what does the nurse do?
Well, Patty,
Sierra, you want to take that one?
when I
I
haven't
got my
agreed,
answer.
well, see, I'm speaking from the nurse's point of view. So
Uh-huh.
I definitely would go, I wouldn't take it what the doctors say all the time at face value. So I would go to my
Right.
supervisor or you can go above to their medical director and just kind of say that you don't agree that,
Okay.
you know, is this really, or like getting a second opinion also, like if you don't,
Right.
because sometimes I don't agree and then with the order, and then I'll ask, I'll get my nurse manager to talk me through it. And some things, if I don't feel comfortable with, I won't do it.
Good.
So
Jerry, I had that happen. Jerry, I had that happen when I was working as a nurse when I was still able-bodied. And I had that happen that the doctor wanted to do so-and-so for this baby that I was taking care of. The transport team was there picking up the baby to transfer him to another higher facility. And the doctor wanted me to do so-and-so for this baby. And I had the NICU background. He was a pediatrician. He did not, he was wrong. He was totally wrong as to what he wanted done. And I told him, I said, I'm not doing that. And he said, so when the transport team arrived, we asked them to, and they agreed that what he wanted to have done was totally wrong, that it shouldn't have been done. And he said to me after that, he said, once they're gone, you and I are going to discuss this option. Okay. And the nurses, a lot of the nurses know, Jerry, and I'm not saying that the doctors are dumb, they're not, but some of them just don't know everything. And like I said, we can always escalate if you're seeing they're just not getting along with their decisions here.
That's good advice. My ex-wife is a family practice doc, so she comes from a doctor's perspective, and she's always right. So that's why we're not married now. I have a couple of other questions. I go to the VA, so every now and then there's procedures that I wonder if I should have the VA do it or some outside doctor do it. And I'm not asking you to call names or anything like that, but what's your opinion on the outside versus the going with the VA? So I pick certain procedures to do. What's your advice?
I have no advice on that, Jerry. I don't, as to whether or not the VA or the outside physicians, I'm not sure with that. Like I said, I did work at the VA hospital for 2 years and I was fine. The only thing I just want to throw out is just keep in mind to make sure you're dealing with a doctor and not a resident.
Yes, that
happened
to me. That happened to me. I'm not going to go into it, but a student was doing my procedure, and I found out, and I said, "Why was he doing that?" He said, "Oh, we didn't ask you." No, you didn't. But that's another topic.
And Jerry, just so you know, too, on that, Jerry, when I was pregnant with my 2 children, I was in a teaching facility too, and I told them specifically, no residents are going to assist me on my delivery. So you've also got that option. You can always say, I don't want a resident. I want a doctor.
Okay, that's good. Thank you so much.
You're welcome, Jerry. Sierra, is that right?
absolutely.
Okay, thank you.
Hey, you're the guru. I'm just here. I'm learning from you today.
Well, I didn't know if you had something special to add.
No.
Anything else?
I was about to say we're right at time, but we can probably take one more question if anybody has a lingering question.
No, thank you, Patty. Did a good job.
I
Yep.
did just want to say,
I was very nervous for this, but when I see the faces of the people that I know and love, I was good. I was good with this. So I hope this has helped all of you all.
It has.
Good. I want to thank you all. I want to thank Sportable for asking me to present this. Caitlin, this was a great idea, so I appreciate that.
Well, thank
Patty.
you, Patty, for being here and sharing your wisdom, your lived experience, your expertise, all of this with us. And again, I will send out this recording to anybody that was registered for the webinar, and it will get posted to YouTube sometime in the next few weeks. And I'll make sure you have that link so this can continue to live on as a resource for anyone that feels it would be helpful information to them. So thank you all for joining tonight, for spending your evening with us. And big thank you, Patty, for all the helpful information you're able to share.
Right. Thank you all.
Thank you, Patty.
Thank you, Patty.
Thank you.
Bye.
Bye.